Okay, so I'm knocking on the door and checking the sign to see if I need to put on any PPE clothing. I'm entering the room. I'm setting up to take care of her nails and her feet, or in her toenails. So I'm going to go to the overhead bed table. I'm going to place paper towels. Well, normally the overhead bed table would go over her in the chair, but we can't. I'm going to place the water basin for her feet, and I'm going to place the kidney basin. I'm going to place the nail clippers. I'm going to place the nail file, and then my orange wood stick. I'm going to make sure that I have 2 pairs of gloves, because I do have to switch out from the nails. And then when I do the feet, I'm going to identify my patient. Hi Dawn, I'm Abby. Today I'm your CNA. I will be doing your nails and your toenails. Can I see your bracelet, please? Okay, when's your birthday?
11/13/71.
Okay, so I'm going to be helping you over to your chair. You could sit up on your bed, please. I'm going to grab my gait belt, put it around my patient. I'm going to make sure the gait belt is tight to where I can only put 2 fingerprints or 2 fingertips under. And on the count of 3, we're going to push up from the bed and then stand up. Make sure your head is straight. 1, 2, 3. Okay, now we're going to pivot towards the chair. And then I'm going to remove the gait belt. And place that to the side for now. Then I'm going to place the bed mat underneath my patient's feet. Then I'm going to fill the water basin 2/3 about with the temperature that the nurse told me to. And then I'm going to be placing that on the bed or on the bath towel or bath blanket, and I'm going to place my patient's toes in there. Do you want to come out a little bit? Okay. And then I'm going to put the overhead or overbed table over my patient, and I'm going to place the I'm going to fill the kidney basin about 2/3 with the same temperature that the nurse told me. I'm going to place that on the overbed table. And then I'm going to have the fingertips soak for 5 to 10 minutes and then the toes soak for 15 to 20 minutes. So we're waiting. Oh, shoot. Okay, I'm helping my patient put her fingernails into the kidney basin. And then I'm waiting the 5 to 10 minutes and the 15 to 20 minutes. Should I just skip that? Okay, so that's passed. I'm going to remove the kidney basin. And I'm going to dry your fingertips thoroughly between the fingers, underneath the fingernails, on both hands. Oh, I forgot to wash my hands and put gloves on. Okay, I forgot to say that I put gloves on before I did this. And so I'm drying your fingers underneath, making sure that the towel is drying everything thoroughly. Then I'm going to use the orange stick to push back my patient's cuticles. Push back every cuticle. And then I'm going to make sure to scoop underneath the nail to make sure that there's no dirt or anything on both hands. Okay, and then I'm going to clip each fingernail straightly across, no curves. Clip, clip. Then I'm going to take my file, or they call it an emery stick, and make it smooth, just as much as you need to, or you think you need to, on every single fingernail. And then I'm going to warm my lotion, so it's warm. I'm going to take it and put it over my patient's hands, in between the fingers. Do the same on the other hand, in between the fingers. Then I'm going to move the overhead table to the side, so this isn't here anymore, so your hands are just in there. I'm going to remove my gloves, rewash my hands, and then I actually have gloves for this one, so I'm gonna put gloves on after I rewash my hands. Okay, then I'm going to lift 1 foot out of the water basin, clean in between the toes, thoroughly wash by the ankle, underneath the feet, and the heel. Make sure that the toes are thoroughly dry. And then I'm going to put the towel next to me. I'm going to take the washcloth, make sure it's soap water, wash the foot in between the toes. Then I'm going to put it back into the water to rinse and make sure that it's rinsing in between the toes. You have to really make sure of that. Then I'm going to remove the other foot, dry it in between the toes thoroughly by the ankle, the heel. Then I'm going to take my other washcloth, make sure it's soapy, clean in between the toes by the heel, make sure you're getting the whole foot. Then I'm going to put it back into the water to rinse, making sure that I'm putting my fingers through the toes to make sure all the soap gets out. I'm going to take my other towel and remove the feet, dry them thoroughly. Now this isn't going back into the, well, it's going on this bath towel, and then drying this one thoroughly, making sure you're getting in between the toes. Okay, and then I'm going to remove the water basin, put it to the side. I'm going to get lotion, put it all over the feet except in between the toes. So I'm making sure you're getting the heel, the ankle, underneath the foot, above the foot, on both sides of the feet, making sure that the lotion is warmed first. Okay, and then I'm going to remove this bottom towel, place it to the side. I'm going to help her put on her non-skid footwear. I'm going to remove my gloves, discard of them, washing my hands. I'm going to ask my patient if she's comfortable. Are you comfortable?
Yes, I am.
Do you need anything else from me today?
No, thank you.
Okay, I'm taking my equipment and rinsing it off, cleaning it with soap, drying it, and then I'm going to take my equipment with me. I forgot to close the curtain in the beginning, but pretending it's closed, I'm going to reopen it. I'm going to check the room for safety, making sure that there's nothing that can harm my patient. I'm going to replace the call light. And then I'm going to make sure that I take my equipment and throw away of anything that I need or that could harm my patient. And then I'm going to leave the room to record and report my observations.